Hello and welcome to the Dr. David Hanley Osteoporosis Center's video presentation on osteoporosis and bone health. This is the first in a series of 3 online videos. If you've already attended our osteoporosis and bone health class in person, use this video as a review. If you think you would like to see a specialist at our clinic, you will need a doctor's referral. It is my pleasure to guide you through this presentation. Before we start, we want you to know that the Dr. David Hanley Osteoporosis Center has no connection with any drug or supplement company. This video is for your education only and should not be taken as direct medical advice. You should always check with your doctor before making new decisions about your health. This video will provide information for postmenopausal women and older men with osteoporosis or individuals concerned about their bone health. In this presentation, we will cover the following topics. What is osteoporosis? What are my risk factors and how osteoporosis is diagnosed? How to protect my bones whether I have osteoporosis or not, and where to find more information. Some important things we'd like you to know before we get started. Bone breaks become more common as we age, but breaking bones is not a normal part of aging. Healthy bones should not break with everyday activities. Men and young adults also get osteoporosis. Osteoporosis can happen to anyone. So what is osteoporosis? Osteoporosis is a medical condition where your bones are weaker. This is caused by bone loss or changes in bone structure. Many factors contribute to this bone loss and increase the chance you will break or fracture a bone. Bone has many cells. Some cells work to form new bone, and other cells work to remove or break down older bone. These cells work together to maintain healthy bone. What does the term osteoporosis mean? When we break down the medical term into 3 parts, we know that osteo means bone, poro means porous or brittle, and osis means a condition of. So when we put the word together, it means a condition of having porous or brittle bone. It is important that we all know about osteoporosis because bone loss occurs in nearly everyone as they age. Osteoporosis is most common among Canadians 60 years of age or older. In Canada, it is thought that up to 40 to 50% of postmenopausal women and 20% or 1 in 5 men over the age of 50 will sustain a broken bone related to osteoporosis at some point in their lives, mostly as they approach older age. As the number of older adults increases across Canada, fractures related to osteoporosis will become an increasing concern both for patients and the healthcare system. It is important to try to prevent broken bones, otherwise this can lead to immobility, loss of independence, pain, and in severe instances, death. What is the difference between osteoporosis and osteoarthritis? There is often confusion between these 2 conditions. Let's look at these closer. Osteoporosis is a condition of having decreased bone strength from less bone mass and quality. There is an increased risk of breaking bones with osteoporosis. It is a painless condition until you break a bone. Osteoarthritis is a painful condition to the joint areas of bone and can include the joints in the spine. It is the most common form of arthritis. Osteoarthritis is sometimes called wear and tear or degenerative since it is linked to aging and long-term repeated use or breakdown of normal joint surfaces. These conditions can occur at the same time, but are not directly linked to one another. When we talk about treating osteoporosis, we are really talking about medications to reduce the risk of breaking bones. Unfortunately, osteoporosis treatments will not help with pain or osteoarthritis. These issues are separate and require separate treatments. With osteoporosis, you may not feel any pain, Broken bones related to osteoporosis most commonly occur in the hip, spine, and wrist. Osteoporosis is diagnosed with review of a patient's medical history, including risk factors for osteoporosis, and sometimes a bone mineral density test, often called a BMD. A BMD test alone cannot be used to diagnose osteoporosis. Osteoarthritis often causes pain, stiffness, and reduced movement in the affected joint. It often affects the hips, knees, fingers, feet, and spine. Osteoarthritis is diagnosed with X-rays, a physical exam, and a medical history. These conditions can occur at the same time, but if you have one condition, it does not mean that you will have the other. Bone is a living tissue that changes all the time. Our bones are constantly breaking down and rebuilding to form new bone. We call this remodeling. But when you have osteoporosis, your bones break down faster than they can regrow or be replaced. They get thinner and weaker, which means they can break more easily compared to when you were younger. Full skeletal height, maximum or peak bone mass, for men and women, is reached in our 20s and early 30s. Bone mass remains mostly unchanged until the age of menopause, or age 60 for men. After this, all women and men begin to lose bone mass. It is a natural part of aging that we will lose bone mass as we get older. Although our genes help to determine the size and strength of our skeleton, good bone health also starts in childhood with a healthy lifestyle. Children should be encouraged to eat a well-balanced diet with enough calcium and vitamin D and plenty of physical activity. Other positive lifestyle habits, such as not smoking or not drinking too much alcohol, will also help. There is no single cause of osteoporosis. Risk factors that contribute to the development of osteoporosis include age, having a fragility fracture after the age of 40, genetic susceptibility, often detected by having a parent with a history of hip fracture, early menopause before the age of 45, smoking, consuming 3 or more alcoholic drinks per day, leading a sedentary or inactive lifestyle, long-term use of glucocorticoid steroid like prednisone for greater than 3 months, having a very low body weight. Other risk factors for osteoporosis include use of certain medications such as those for breast or prostate cancer or diuretics that increase urination and loss of calcium, having a medical condition that may contribute to bone loss such as thyroid conditions, hormone disorders, rheumatoid arthritis, chronic liver, kidney, or lung disease, and lastly, having medical conditions that impact the absorption of nutrients from foods, such as celiac disease, Crohn's disease, and colitis. The key to managing osteoporosis is to prevent future fractures or breaking bones from happening. First, let's talk about common fracture sites. The most common sites where we see fractures associated with changes in the bone, osteoporotic fractures, are of the spine, wrist, hip, and/or the shoulder. We call these fragility fractures. Broken bones do happen in different sites, such as fingers and toes, but these are not considered fractures related to osteoporosis. What is a fragility fracture? A fragility fracture is a fracture that happened after a fall from standing height or less. For example, you got out of bed and tripped over a rug, fell, and broke your wrist. That would be a fragility fracture. A traumatic fracture is just how it sounds. There was a trauma that occurred and broke a bone. For example, a fracture from a car accident or falling from a ladder 6 feet up or greater than your own height would be a traumatic fracture. If you have had a fragility fracture and you are over the age of 40, it is likely associated with osteoporosis. We will now provide you with some information about the most common fracture sites for osteoporosis. we will talk about fractures of the spine, hip, and wrist. Spinal compression, vertebral fractures, are small breaks that occur in the bones or vertebrae of your back. These small breaks can continue to break until the bone collapses. These fractures or breaks can result from reaching, bending, lifting, and can even occur with coughing or sneezing. 2/3 of individuals with compression fractures do not feel any pain, and most don't seek medical attention. These fractures can change the strength and shape of your back and lead to a loss in your height. A 2 centimeter or more change in height per year may be a sign there is a fracture. Pain medication, decreased activity, bracing, and in some rare cases surgery may be required as treatment. Hip fractures commonly occur from a fall or an impact to the side of the hip, causing a break in the upper thigh bone or neck of the femur. Pain occurs over the outer upper thigh or the groin region, causing significant discomfort. For some, a shortening in leg length may also be noted. Surgery to fix the broken bone in place can include the use of hardware such as screws, nails, or plates. Others may require surgical replacement of some or all of their hip components. A hip fracture always needs medical assistance. A wrist fracture is often an early warning sign of osteoporosis. Unfortunately, up to 80% of people over age 50 who have a fragility fracture of the wrist are not assessed or treated for osteoporosis. If a fracture occurs, it is helpful to tell your healthcare provider the answers to these questions. Which bone fractured? How did it happen? Was the injury from a fall from standing height and without force, in other words, a fragility fracture, or was it from a traumatic event? Now let's talk about some tools used to determine the health of bones. One tool used is a bone mineral density test, or BMD. Other tools we use to give us a more accurate picture of bone health include a thorough review of your risk factors and health history. A bone mineral density test is an enhanced type of X-ray exam used to measure the amount or density of patients' bones. It measures bone quantity. BMD does not show the quality or strength of bone. A BMD is often done if there are risk factors for osteoporosis. However, in some cases, the diagnosis of osteoporosis is obvious based on the patient's age and story. In such cases, a BMD test may not be needed. BMD is not a routine test to be done each year. This test is usually done between 2 and 5 years and at the same BMD location each time. Remember that having a low bone mineral density, BMD, is only one risk factor for osteoporosis. It is important to understand if there are other risk factors influencing your bone health. Your doctor can help you calculate your risk of having a fracture in the next 10 years by using a tool created by the World Health Organization called the FRAX tool, F-R-A-X. With this score, a doctor can help you understand your risk of fracture and discuss what options might help lower this risk. Whether you have osteoporosis or not, there are important things you can do for your bone health. We call this good hygiene for bones. Knowing that we all age and lose bone in the process, we need to do what we can to keep what we have and potentially slow the rate of bone loss. For some people, medication is warranted. Medications can help reduce your risk of breaking a bone upwards of 40%. No one has to take medications to prevent a fracture from happening. It is 100% your decision. Good hygiene for our bones is important for all of us, whether we have osteoporosis or not. There are things we can do to protect our bones. Taking care of your bones means being physically active every day, eating a well-balanced diet, including vegetables, fruits, and whole grains, and getting enough dietary protein and calcium, taking a vitamin D supplement, limiting sodium or salt, caffeine and alcohol, putting a plan into place for preventing falls, stopping to smoke, and taking medications as prescribed. For more information and resources to support your bone hygiene, please see the Osteoporosis and Bone Health Bone Hygiene video, the second in our series of 3 online video presentations. The most important reason for treating osteoporosis with medications is to reduce the risk of breaking bones. It is also important to remember that medication does not cure osteoporosis. As well, medications only work if taken correctly. For example, most osteoporosis medications cannot be taken at the same time as calcium or other supplements, and often must be taken on an empty stomach. We know that if we are taking medications for bones, these medications work better when we practice good bone hygiene. For more information on osteoporosis medications, please see the Osteoporosis and Bone Health Medications video, the third in our series of 3 online video presentations. This brings us to the end of our first video presentation, Osteoporosis and Bone Health. We hope this video has added to your knowledge of osteoporosis. Please visit our clinic website, osteoporosiscalgary.com, frequently for further information. If you have a referral to see us here at the Dr. David Hanley Osteoporosis Center, we look forward to seeing you. Here is our clinic address: Richmond Road Diagnostic and Treatment Center in Calgary at 1820 Richmond Road Southwest. We are located on the 2nd floor. Stay connected by visiting us at osteoporosiscalgary.com. On our website, under the Patient Information section, we have a complete description of how to get to our clinic, where to park, and what to expect at your clinic visit. We encourage you to review our website before you visit with us. Thank you on behalf of the Dr. David Hanley Osteoporosis Center for taking the time to learn about osteoporosis and bone health.